All right, so we're diving into something today that might sound kind of scary to some, right?
Hmm.
We're talking about heart murmurs.
Yeah.
And whether you've dealt with this yourself or just, heard the term and wondered what it's all about, today we're really going to unpack it, figure out what a murmur really means.
Right.
And to help us do that, we're going right to the source. We've got insights from a cardiologist, Dr. Aldo Santos, to break it all down.
It is interesting, how just hearing those two words, heart murmur, can send people like straight into a panic spiral.
Yeah.
But it's a bit like a medical mystery. You got to
Yeah.
follow the clues to figure out what's really going on.
Ooh, I like that. A medical mystery. Okay, so walk us through it. What actually is a heart murmur? What's happening in there?
So Dr. Santos uses this analogy. It's like an extra sound the heart makes, one that a doctor could pick up with a stethoscope. So that's like an extra little whoosh or a swish in there with the normal lub-dub, lub-dub. But here's the thing. The murmur itself, that sound, it's not actually the disease. It's a symptom. It's a sign that something else might be going on.
Okay, so like it's not the crime scene itself, but it's like a clue that can lead us to it.
Exactly. And that is precisely why he really emphasizes this, Dr. Santos, that figuring out the cause of the murmur is key.
Yeah.
Because just knowing you have a murmur, that's like, okay, we know a crime happened, but we don't know who did it, why they did it. We need that full story to really understand what, if anything, needs to be done about it.
That makes a lot of sense. So let's address, I guess, what's probably on everyone's mind. Are all heart murmurs cause for like serious worry?
Right, and this is where understanding the different types of murmurs is so important. Some murmurs, yes, absolutely, they can be a sign of a serious condition that needs attention. But many, and this is especially true in kids, are totally harmless.
Okay, well, that's reassuring to hear, especially for, any parents out there who might have just gotten this diagnosis for their child.
Absolutely, yeah. And, there's this common misconception that all heart murmurs equal heart disease. While heart disease is a frequent culprit, it's not a simple one-to-one thing. It doesn't always cause murmurs, and not all murmurs mean a bad heart, thankfully.
Right, so no easy answers there, which is, I guess, why we're digging into this. Now, you mentioned, I think it was Dr. Santos who said this, that even things like anemia or pregnancy can cause a murmur.
Yeah, isn't that wild?
It's amazing.
It just goes to show you how interconnected our bodies really are.
Yeah.
And he actually breaks down the causes of murmurs into three main buckets.
Okay, well, lay it on us. What are they?
So first, you've got your heart-related causes. Makes sense, right? And some of these, they're congenital, meaning they're present at birth.
Mm-hmm.
And then you've got others that are acquired, meaning they develop later on in life due to things like high blood pressure or even damage from like a heart attack.
Okay, so two very different timelines there, but both end up kind of messing with the heart's mechanics.
Exactly. Then you've got what are called non-cardiac causes, and these are usually temporary, thankfully.
Okay.
It's like the body's throwing a little curveball. Things like fever or a vitamin deficiency can actually cause a murmur, but once you address the underlying issue, the murmur often just vanishes too.
So it's like the heart's waving its hand saying, hey, something's up over here. You might want to,
Right, pay attention.
yeah, come take a look at this.
Exactly.
Okay, so that's two categories. What's number three?
All right, and lastly, we've got the innocent murmurs. And I kind of love that term.
Yeah.
It sounds so, I don't know.
Kind of cute.
Yeah, a little bit, right?
It's not as ominous.
Exactly, not ominous at all. Basically, it's the heart's version of a kid making funny noises.
Mm-hmm.
Totally harmless, and they often just disappear with age.
Okay.
Though, Dr. Santos does point out that, and this is kind of wild, you can actually have multiple murmurs happening at the same time.
Oh, wow, from different categories.
Different categories, yeah.
That's a busy heart.
It really is.
Yeah.
But I guess it highlights that every murmur is kind of unique.
Yeah, definitely. Okay, so we've talked about what they are. Let's get into the what now. If someone thinks they might have a murmur, what should they do?
First and foremost, don't panic. Knowledge is power,
Yeah.
right? And just understanding the range of possibilities here is so important. Dr. Santos, he emphasizes how crucial it is to see a doctor to get it checked out. And they'll likely do some tests, things like an electrocardiogram or EKG. You probably heard of that. It measures the heart's electrical activity.
Mm-hmm.
Or they might do an echocardiogram, which is kind of cool. It uses sound waves to create images of the heart structure.
So those tests can give a much clearer picture of what's going on.
Absolutely. And then once they figure out the root cause, the treatment can be like totally tailored to you. Dr. Santos really emphasizes how, for some people, simple lifestyle changes might be enough. So we're talking things like diet and exercise. But for others, medication or even surgery might be necessary. It really depends.
So it's really a matter of, working with your doctor, not just stressing out alone in the dark about it.
Exactly, yeah. Informed patients are empowered patients.
That's so true. Well, this has been super insightful. Now, to leave our listeners with a little something to ponder, something Dr. Santos said really struck me. He pointed out that, things like our diet, even just how much we exercise, can actually cause certain types of heart murmurs. So that just made me think, like, wow, the connection between our overall health and our heart health specifically is pretty powerful, right? Something to think about.
It really is.